Hello everyone. So I hope everyone is doing in this uh, tough times that we are facing. Very tough time for everyone, and the COVID-19 is spread everywhere, and the pandemic is on. So today we are going to discuss about something we call PICO, and it is one of the most important aspects of evidence-based practice, and it's one of the foremost step of the evidence-based practice. So we all know what is evidence-based practice. It's the use of scientific literature combined with the clinical expertise, along with patient values and their considerations and their circumstances, is known as evidence-based practice. So it's a continuum model in which all three has their own roles, and one of the pillars is scientific research. So we need to look up for scientific research when we see our patients. Okay, so let's dive deep into the topic. Okay, so these are the steps of evidence-based practice. Uh, The first step is the patient comes to me, and then there arise a clinical question in my mind. Okay, do I need to use this or do I need to use that? Now that question should always be answered using research or scientific literature. It should not be based on just my clinical expertise or the patient's circumstance. So I need to look up for a scientific literature, scientific article which supports my claim in a way. So, for example, a patient comes to me and he's complaining of that his knee is buckling, and now I need to confirm, and I might be using a test. So, which test should I go for, and which test is more reliable or valid? Will be explained by the scientific literature. So the first and the foremost step of EBP is the patient coming to my clinic. I am seeing the patient, and when I'm seeing the patient, there comes a question into my mind, for example, whether to use eccentric strengthening or slow heavy resistance exercise program, whether to use a progressive loading or whether to use static loading. So it depends on patient to patient. Plus, I need to see whether there is an evidence for what I'm deciding is the first step of evidence based. Second and the foremost step is developing a well-built question. So I need to build a question uh, for which I can look up for the evidence. For example, a patient comes to me having pain in shoulder. So I started rehabilitating him. So whether I should use isometric strengthening, isometric exercises versus iso toning, or better terminology is isometric versus eccentric. So which exercise should I recommend or should be starting with? So this will lead me to formulate a question that we call as developing a well-built question. The third step we are not going to discuss is basically, now I using this question I'll formulate search strategies which I'll be using on different databases like Pedro, PubMed, Embase, Scopus. Different databases are available where I can simplest one is Google Scholar. Okay, sorry. So then we can go for then is the next step which we'll be discussing in the upcoming videos, where we'll discuss about how to evaluate the strength and applicability of the evidence, how to apply it, and final is the checking whether I've done everything correctly or not. Okay. So the first step is research question. So I need to formulate a clinical question or clinical searchable research question for which I need to look up for. So this is PICO. So what is PICO? PICO is just used to form a searchable research question. Uh, P has stands for patient, problem, or population. For example, what are the most important characteristics of the patient and their health status? I stand for intervention, what I am going to give, and sometimes what I am going to compare it with. So C is for comparison. Okay. O is for outcomes. What is the estimated likelihood of a clinical outcome? Very simplest example if I can give is if a patient comes to me with ankle sprain and I want to use an ultrasound. versus not using an ultrasound. So, or maybe ultrasound versus ice. Uh, so I want to see which is going to release the swelling more. So a patient will be my ankle sprain, or the population, or the problem will be ankle sprain. Intervention will be ultrasound and ice or cryotherapy. Comparison is ice versus ultrasound. Outcome is how much reduction is there in swelling. Similarly, this acronym can be used to formulate different searchable questions and well-defined searchable questions. So the success of an evidence-based practitioner depends upon how nicely or how well built is the research question using the FICA formula. So again, I repeat, PICO is P is for patient population and problem, three P's, I is for intervention, C is for comparison, and O is for outcome. So let's take an example now. So I am working in a hospital. I want to know basically whether hand washing is if going to reduce hospital acquired infections or not. So I need to formulate a searchable question. So here my population or problem is hospital acquired infections. Intervention is hand washing. Comparison is no hand washing or other solutions or other mask or hand sanitizers. O is an outcome. So the question which I can formulate now is, does hand washing among healthcare workers reduce hospital acquired infections? So this is just a practical application of the PICO format. Now we all look up for evidence, and this is we look for different types of things on the databases. For example, I'm not just interested in looking up for interventions. Sometimes I'm looking up for a diagnosis. Example is whether MRI, whether I should prescribe MRI to my patient or not. Okay, whether MRI will help in diagnosis or not. Whether this test is a good diagnostic tool or not. Etiology. Sometimes I may look up for the cause of a problem, or how can I prevent a particular problem. We can look up for prognostic based studies. Okay, when will my patient return to sports? When will my patient heal? What is the extent of soft tissue healing? Then quality of life, and then finally is the therapy. So basically, after patient client model, if you look at, we have interventions, we have examinations, so different components is what we can look up for the evidence. Now the key here is to understand that there are different types of studies. We have RCTs. I'll make up a short video again for this. We have cohort based studies, we have case control studies. So when we are looking for interventions, let's just take an example of interventions. The best study to look for is an RCT. So depending on the other types of evidence that I'm looking up for, the quality of or the study will, the design or the study type will change. So this is the most updated one, and PICO, we now call it as PICOT. So I'll just read it out for you. We have P is for patient and population or problem. So who are the relevant patients? We need to think about their age, about their gender, about their geographic location. So we have to be very precise about defining our population. Intervention. Okay, I is for intervention. So we have to be very specific about what management, okay, what particular diagnostic test or exposure that we are thinking about. Then again, compare what acts exactly are we comparing about between two. Is it a control or not? O is for outcome, and what are the patient relevant consequences of the intervention, whether I'm measuring pain or I'm measuring swelling or I'm measuring something else. Time is dependent on what time period of studies I'm looking for. For example, 2005 to 2010, what work was done, or maybe recent studies. So that will likely tell me about, okay, what time frame I'm trying to look. Then type of question, what clinical domain does your question fall? So last slide I tell you whether I'm trying to answer a diagnostic answer study, whether I'm trying to find an etiological based answer. So that depends upon that. Looking at the example, I think the things will be a little more clear. Now you can judge here what is a better question depending upon the PICO format. So what is the best treatment for back pain? It's very, if you search for this, you will get thousands and thousands of articles. But if I refine it using PICO format, Like for example, in adult patients, okay, so this is my population, younger than 50 years old with acute low back pain. So I've defined my population, I've defined my problem, that is acute less than 6 weeks. Does bed rest reduce the risk of recurrence of pain within 1 year? And now I'm comparing it with physiotherapy. So the second question, of course, is the better question, which is going to result in better research, searches, better evidences. So this is for your example, or a task. You can pause the video, read the case that you are presented. This is a case which presents to your clinic. So a 47-year-old patient comes to you with a unilateral low back pain after lifting some heavy boxes at work. Now, when you did an examination, you had found that he is having stiffness and he's having pain in almost all of the movements. And there is a very slight joint palpation that is unilateral at the level of L2 and L3. Now, you think that specific unilateral mobilizations is the choice of treatment, uh, and you used it, would be helpful to clear the joint symptoms in several sessions. But have read in the literature recently that exercise therapy alone may be more cost effective. That means you can give a home exercise program and the patient can be better. So what I want you to do here is just pause the video for a moment and try to formulate a question for this patient. So in real life scenario, what will be the question that you will form and you look up for? Then you can check basically whether you have formed the right question or not. So now my patient population or problem is a unilateral low back pain, and I'm trying to use this mobilization, maybe Calton-Bond, maybe Maitland, Mulligan, comparing it with exercise therapy, and my outcome is to reduce pain and stiffness. So now I formulate a research question here is, in a 47-year-old man with unilateral low back pain, is exercise therapy alone more effective than joint mobilizations at reducing pain and restoring range of movement? So this is the basic idea of PICO. See, in evidence-based practice, we as physios are following a lot of things which are not evidence-based. So unless and until we decide and understand what is evidence-based practice, we try and understand how to formulate research questions or searchable questions, clinical questions whenever patients come to us. It is very difficult to implement evidence-based practice into real-life situation. Okay, so this is the video where I try to explain what PICO basically means. And so now whenever you see a patient and you think of a particular situation, just try to formulate a searchable question, look up for that question, get the evidence, read it, try to appraise it and apply it. So appraisal, we'll have another video. We'll try to understand how to appraise different types of studies. Here we were just interested in making you understand what PICO is. So I think I summarize. PICO basically means a way of formulating a searchable question where P stands for patient, problem, or population. I stands for what I'm trying to give an intervention. Comparison, with which I am comparing it with. And of course, the outcome is the desired outcome I wanted to see in the patient. I hope everyone understands. Okay, so see you in next video. Thank you so much for listening.